Joining me today on the call is Hamza. Hamza, please take a minute to introduce yourself.
Thank you, and good morning, everyone. My name is Hamza Benzine. I'm a Senior Business Development Associate and Senior Business Analyst at SSAI. I have a background in developing go-to-market strategies, relationships, and growth projects in the big data, finance, and AI, ML, enhanced predictive maintenance spaces. And I truly believe in technology adoption, so I'm an evangelist for technological progression. And I believe in working towards a technology-mediated future in which people, especially in human-centered areas like healthcare, enjoy safer, more productive, and more meaningful lives. So I'm looking forward to today's webinar.
Thank you so much. Okay, so we can get started. The state of public health funding for public health programs has been decreasing in the recent years, forcing healthcare providers to make tough choices about which services to prioritize. As a result, access to care, especially in underserved and rural areas, has been severely compromised. These cuts have reduced healthcare access, especially for low-income, rural, and communities with limited access, creating greater barriers for patients who already face challenges in accessing care. Health systems are under increasing strain, and hospital closures and workforce shortages, leading to longer wait times and reduced access to preventative care, has been an ongoing issue. The public health system, which traditionally relied on robust funding, mostly now looks at alternative solutions to maintain its mission of delivering quality health care. This is where small businesses and innovative technology companies can step in to provide cost-effective solutions that enhance healthcare delivery and patient outcomes. This is not only the current situation and what's going on affects individual hospitals as well, but also weakens the healthcare system as a whole. However, innovation offers a path forward. Small businesses and startups are leading the change with new technologies, new business models that provide scalable, affordable healthcare solutions. It can also help reduce the overall cost of healthcare, and alternative methods of receiving health. By supporting innovation, we can transform the current funding crisis into an opportunity to build a more resilient and accessible healthcare system. Overview. Programs like Medicare, CHIP, and funding for community health centers have all been impacted. These cuts have a direct effect on healthcare access, particularly for low-income, rural, and underserved communities. The result is fewer resources, fewer services, and greater barriers for patients who already struggle to access care. Growing strain. Health systems are being pushed to their limits. We're seeing hospital closures, particularly in rural areas, and a shortage of healthcare workers, nurses, orderlies. We're moving away from full-time care to you know reduced accessibility in terms of care or even home care takers. For patients, that means longer wait times and greater difficulty in getting preventative care, services that are critical to avoiding more serious, costly conditions. Ultimately, these funding cuts don't just impact individual hospitals, they weaken the entire health system. Importance of innovation to bridge the gap. Despite the challenges, innovation presents a real opportunity. Small businesses and startups are leading the way, as I mentioned, with the new technologies, scalability, affordability, healthcare solutions, with the assistance of AI, with the assistance of virtual integration, and you can now have virtual appointments when you don't have access to mobility or transportation. Innovation isn't just about new tools, it's about rethinking how care is delivered to meet people where they are, even with fewer resources. If we support innovation, we can turn today's funding crisis into a catalyst for more resilient, accessible healthcare systems. Now, possible solutions to address healthcare access challenges: strengthen community healthcare programs, expand the role of local clinics, nonprofits, and health workers to deliver essential services efficiently. Increase use of telemedicine and remote care tools, provide patients in underserved areas with access to specialist and routine care without the need for large physical infrastructure. Support workforce retention and well-being, implement flexible scheduling, mental health support, and professional development programs to reduce burnout among healthcare providers, develop mobile health innovations, develop mobile units providing preventative material and maternal health services to reach rural and low-income populations directly, enhance resource coordination and efficiency. Use technology and data analytics to better align staffing, supplies, and services with communities who need it, minimizing waste, maximizing care delivery. Foster training, upscalability for local partners, invest in community-based training, empower local residents to become healthcare workers, ensuring scalability and staffing in underserved areas. Next slide, please. Now, small companies can fill the gap. As I mentioned, small companies, particularly those in technology and healthcare innovation, are uniquely positioned to fill the void left by federal funding cuts. They can quickly develop and deploy cost-effective solutions such as telemedicine platforms, AI-powered diagnostics, and mobile health apps. The help extended through this reach will help healthcare services. These solutions can be tailored to meet the specific needs of underserved communities, allowing for more efficient use of limited resources. Additionally, small businesses can form strategic partnerships with public health agencies, enabling them to integrate their solutions into existing health systems and maximize their impact. Innovation solutions. Small businesses being agile and creative that can help the larger system and can strengthen the weaknesses we currently have. They can design targeted, affordable interventions like mobile clinics, health platforms, and remote monitoring tools tailored to underserved populations. Their adaptability allows them to pivot rapidly as health needs evolve, filling critical services gaps, primarily health deserts and rural areas. Scalability and cost effectiveness. Small businesses operate with leaner infrastructure, allowing them to scale rapidly and within certain regions without the cost burden and the infrastructure challenges of larger companies and or government subsidized programs. They can pilot projects locally, fine-tune solutions based on real-time data, and expand only what works, minimizing waste and maximizing value. Their cost infrastructures and structures often make them ideal patterns for public health agencies working within tight and or shrinking budgets. Public-private partnerships. Small companies are increasingly successful in forming strategic alliances with public agencies and nonprofits, as well as new startups within the health IT community. These partnerships allow for small businesses to introduce disruptive innovations like AI driven diagnostics, health digital platforms, or even the mobile health units into traditional healthcare systems frameworks. Small businesses are driving innovation in healthcare by offering agility and creativity that larger systems often lack. Now, this is something that we need to focus on because we need to be more innovative. We need to be able to mobilize faster. We need to basically adapt to new technology faster, which, again, a smaller framework, smaller companies uh, are positioned to do so, and it's often easier for them to make those changes. They develop targeted, affordable solutions such as remote monitoring tools, specifically assigned for underserved populations. Their ability to adapt quickly fills critical gaps like addressing primary care deserts, as we mentioned before, but it's not just the rural areas because we can find a lack of access within urban areas too, and or cities with heavy populations. There's still the mobility issue, the transportation issue with the elderly, um, disabilities, the transportation with disabilities. We have now mobile vans, mobile clinics that can like go into communities that we didn't have before. There's the diagnostic sharing. Tools can be used to send information to doctors in real time and to share with hospitals. So your doctor can, when they're sending you to a hospital, if you're having a critical medical condition, by the time you arrive in the hospital, that emergency room would have your information. With lean operations, small businesses can scale um, so much and can achieve so much, and their importance is growing and there should be a larger focus on how we transcend that. The strategic partnerships with public health agencies and nonprofit small businesses, disruptive innovations such as AI, diagnostics, as we mentioned, enhancing traditional health frameworks are improving outreach while maximizing the value of limited resources. And so that's one of the areas that we need to focus on. How do we support these small businesses? How do we work with these small businesses, creating these new technologies, creating these new tools, creating new models that will take us to the next level as resources resources are cut, funding is cut, but if strategically it's planned effectively, if the community supports these small businesses, if we can work more effectively and put our faith into moving forward, these are ideal for moving into the next era of healthcare. Next slide, please. So telemedicine and remote care, it's something that we've discussed throughout this presentation. Telemedicine has proven to be essential tool in increasing access to healthcare, especially like we mentioned in certain populations in certain communities where there's no access to transportation. There might be access to internet, there might be limited access to clinics, to hospitals, to health infrastructure as a whole. It allows patients to consult with healthcare providers remotely, which is essentially critical when transportation and health facilities are limited. Telemedicine can reduce unnecessary hospital visits. It can reduce cost, freeing up healthcare resources for patients who need in-person care. By lowering overhead costs associated with in-person visits, such as facility maintenance and staff time, telemedicine offers a cost-effective solution for both patients and providers. Small companies like Doctor on Demand and Baby on Health have already made significant strides in leveraging telemedicine to provide accessible and affordable care to millions of people. Health insurance companies like Care First, Kaiser, pretty much are all on board for telemedicine, televisits, and it does effectively help, especially if your baby has a fever, if you don't, like we keep mentioning, transportation is still a big issue, accessibility to transportation, and it seems to be a recurring issue when we're like doing studies and we're looking in the cost of medicine and healthcare. So those little things that people take for granted can have such a big impact on just cost overall and accessibility. The critical role of telemedicine is such that it becomes indispensable for expanding healthcare access, particularly as we keep mentioning areas without infrastructure that creates for a robust community of health providers, affordability, access, and or even transportation, such as rural low income households. It limits the transportation burden, connecting patients with specialists and primary care providers without the need to travel long distances and the cost of travel. Efficiency and reduced optimization. By handling routine and non-urgent consultations routinely, telemedicine reduces the strain on hospitals and emergency departments. This allows health systems to prioritize in-person care, improving overall patient outcomes and system efficiencies. Cost effectiveness for patients and providers. Virtual visits cut operational costs significantly, lessening expenses like facility upkeep, administrative cost, and wait times. For patients, telemedicine lowers out of pocket expenses and time away from work and family, making care more accessible and sustainable. Small businesses leading the way. Companies like I mentioned, like Doctor on Demand, Kaiser, Care First, are leading examples of how innovation can scale telemedicine solutions nationally and globally. Their models show how small, tech driven companies can disrupt traditional healthcare delivery, um, making high quality care available for lower cost and improving health equality and access. Telemedicine has also proven that technology can be powerful equalizer in healthcare, breaking down barriers of distance, cost, and access. Small businesses are leading this charge, working with right innovation. We can deliver high quality, affordable care to populations who traditionally haven't benefited in the past. Now, for AI and machine learning in healthcare, I'm going to transition over to Hamza.
Thank you very much, Anna, with the caveat that you are a difficult act to follow, but I will do my best. So we're going to talk a little bit about, we're going to dive deeper into the technologies and their applications and why small businesses are well suited to provide this innovation despite the dearth of public funding. And Anna has set, really set the context for us to understand and drill down deeper. In terms of enhancing diagnostics and patient care. Artificial and intelligence and machine learning, it's easy to see them as incremental improvements, but they actually represent a paradigmatic change in how we deliver healthcare, particularly for diagnostics, and in three ways. AI, first of all, is transforming healthcare, particularly in medical imaging and clinical decision making. Second, enhanced image quality and faster detection capabilities are leading to reduced costs and errors. And third, tools for managing uncertainty in clinical decisions can help are helping healthcare providers to make informed uh, choices. And so AI tech like Zebra Medical Vision and ADOC use algorithms to interpret medical imaging, detecting diseases like cancer and stroke more efficiently, more early, with more potency than traditional methods. Machine learning for predictive healthcare, we have tools like Tempus that leverage data to predict the onset of chronic conditions such as heart disease or diabetes. They're saying that in regards to prediabetes, globally, perhaps 1 in 3 people are are suffering from that metabolic disorder. So here we allow for early intervention and preventative care as opposed to the massive costs we see when the crisis unfolds and it's too late to intervene. Some other real world examples include companies like Path AI and Viz AI, which are harnessing AI and ML to improve diagnostic accuracy, treatment timeliness, and especially in high stakes settings like emergency rooms where they have to rely on really robust triage decision making despite the fact that they're strained in terms of people resources and in terms of resources overall, they have to make the right call at the right time. And we're seeing AI and ML really become a multiplier, force multiplier in this area. Next slide, please. Okay, let's talk a little bit about mobile and the power of mobile health solutions. And Anna mentioned earlier the need to meet the patients where they are and not necessarily to have them come to us because you have bottlenecks and challenges such as transportation. And so when you are living in a paradigm where funding and infrastructure are limited, mobile health technology becomes a critical tool, not just a convenience. And by shifting healthcare engagement from clinics to smartphones to wearables to to telemedicine, we truly can meet the patient where they are. We have wearables and health monitoring devices like Fitbit and Apple Watch. They're just getting better and better at providing real-time health data, allowing patients and providers to track chronic conditions like hypertension, diabetes, and heart disease. You have mobile apps for chronic disease management, apps like MySugar for diabetes management and AliveCore for heart disease management that are empowering patients to manage their conditions from anywhere. One of the most surprising facts I learned about the healthcare space is one of the highest causes of medical crises and uh, even going so far as to say medical deaths is the fact that patients aren't taking their medicine on time. They're forgetting to take their medicine. So you have these mobile apps that are acting like the mobile doctor. They're acting like they intervene and they help guide you and make sure you make those critical decisions at the right time. They make sure you remember to take your medication and so on. The interesting, another interesting aspect of mobile health solutions is that they are incredibly potent at increasing patient engagement. You have there's a gamification element to it. There's user design. The experience is pleasurable and aesthetic. There are social aspects to it in that the app is very personable, talks to you as a human might talk to you in a cheerful and very engaged tone. So they keep you engaged with health, increasing your adherence to treatment plans and improving your long-term outcomes. And to give you a little bit of a statistical context for the widespread adoption of mobile health solutions, over 60% of US adults used a mobile health app in the past 12 months. So for fitness in general, including fitness and general wellness apps and the hardware associated with them. You might more so than ever you see people wearing devices like the Aura Ring or the Whoop or the Fitbit, and you find them in very surprising places. There is a vast app ecosystem out there. There are over 350,000 health-related mobile apps that are available, and they span diagnostic aids, treatment guidance, lifestyle coaching, and patient education. And the research does show that these apps are enhancing adherence to medical treatment. So they more than double the odds of a patient sticking to the treatment plan, which includes remembering to take their medication in in the right time. Particularly in the treatment of diabetes, there was a randomized field experiment of 1,070 diabetes patients using a mobile health platform. They saw significant reductions in blood glucose levels. They had fewer hospital visits versus the control group. Let's move to the next slide, please. Okay, so how small companies are addressing public health challenges. So in this paradigm of lack of public funding and the challenges that arise from it, you have, again, this theme of small companies meeting the patient where they are and truly understanding the needs of the patient. Everlywell has at-home testing kits. They developed easy-to-use at-home diagnostic tests for conditions like COVID-19, diabetes, and thyroid issues, increasing patient access to testing. This is just an example of the mobility and the agility of small businesses vis-a-vis bigger players in the healthcare space. Tempus and precision medicine. Tempus is applying AI and machine learning to analyze clinical and molecular data, providing personalized cancer treatment recommendations. So whereas before you saw treatments happening at the generic level, now they're moving towards the very granular, very personalized, very customized, one-to-one patient experience. Bluebird Bio is a gene therapy company that is addressing rare diseases like sickle cell anemia, working with public health agencies to provide treatments to underserved populations. The point is clear. Small businesses are doing this at a more efficient level, at a more agile level, and they are really generating outcomes and changing the healthcare space. Next slide, please. Small companies as key partners in public health. So as Anna has reinforced for us, small businesses have already proven they can fill critical gaps where traditional public health systems struggle. And innovative models are scaling diagnostic access and personalizing treatment often faster and more affordably than regular institutions or larger institutions could. And another interesting aspect is small tech companies are thriving by tapping diverse capital sources. So in the face of lack of public funding, they're going to venture, they're going to grants, they're going to philanthropy, they're going to accelerators, corporate VC, strategic partnerships, all while levering lean operations and explosive market growth to deliver high impact solutions at pace. And one of the beautiful things about small companies is they tend to be very, very disciplined and good at monitoring their cash flow and maintaining a very disciplined balance sheet so that they operate as agilely as possible. So, to reiterate, small businesses are going to become increasingly vital in ensuring the sustainability of public health initiatives. There's going to be a need, and then the only players really positioned to take care of that need are small businesses. There are many, many opportunities for collaboration. Small companies could collaborate with public health agencies, especially local players. They have a rich local knowledge that they can share, enhancing healthcare delivery through innovation and technology. Because small businesses understand their localities, they're also well positioned to uh, to put out pilot programs, and the success of those pilot programs in partnership with public entities can be the catalyst for national scaling or nationwide scaling. So a change in one locality by one small business can change the entire paradigm across the United States and also globally. And then there's also long-term impact. These innovations are likely to lead to a more patient-centered, data-driven healthcare system, improving outcomes and reducing costs in the long run. And I'm going to give it back to you. Thank you.
Thank you, Hamza. Um, as we look to the future of healthcare, it's clear that innovation, collaboration, and agility will be key drivers in transforming the system. The rise of wearables, mobile apps, and cutting-edge technologies like AI, gene therapy, and at-home diagnostics are reshaping how we manage and deliver healthcare. Small businesses, as we mentioned, will be a huge part of this transformation and technology as we move forward. With the ability to innovate and adapt, will play an increasingly important role in ensuring that the public health innovations continue to thrive, especially as federal funding challenges persist. Through collaboration with public health agencies, these companies can help create a more patient-centered, data-driven healthcare system that improves outcomes, reduces cost, and enhances access to care for all. By embracing these advancements and fostering strategic partnerships, we can build a more sustainable and effective healthcare ecosystem for the future. I wanted to mention that we will get back to doing our health IT series once a month. So we'll send out the reminder for the next webinar. We will be touching on issues that are prevalent and are of concern to our community in the next um, cycle of the series for the next phase. We had originally done a heavy focus on the transformation of AI, of newer tools that are coming into the market, and also cyber, the importance of cyber within the health IT community. The next phase for we will focus during the summer in the spring is focusing on how we can help small businesses, how we can partner with small businesses, and how we can bring more information to the public on issues of health IT. Now, I wanted to to open up the forum for any questions that the audience might have. I know that we have two questions currently in the queue, but if anybody wants to submit a question or has a question for Hamza and or myself, please feel free to address them now. Also, I wanted to let the audience know that we will be sending out the questions that were submitted with our feedback after the call for the people that have attended. Thank you so much. One of the questions is how can AI and machine learning be used to personalize cancer treatment? Now, potentially in AI and machine learning technologies like those used by current companies, they can uh, analyze vast amounts of clinical and at a module level the data to identify patterns and insights that help doctors make personalized treatment decisions for cancer patients. These systems can suggest the most efficient treatment plans used on genetic markers and or individual factors, reducing the trial and error approaches and leading to more lean diagnostics, to more targeted and effective therapies, ultimately improving patient outcomes. About a couple of months ago, we had done a webinar on the AI and new therapies treating cancer rehabilitation. If anybody's interested, we can send out that webinar information and some of the questions submitted for that. But it is an interesting field. I think that with the help of AI, with the help of machine learning, we will be able to diagnose cancer faster. We will be able to improve the imaging. I actually wrote a white paper that was posted on LinkedIn on imaging and how AI is progressively improving the results of diagnostic tests and the cost of those tests, and is able to do it in real time. Let's see. We have another question. What are the barriers to innovation in healthcare and how can they be overcome? Hamza, would you like to address that question?
Yes, with pleasure, Anna. So, one of the barriers to healthcare is diverse sources of funding. There are a lot of individuals out there with very interesting ideas, with very interesting projects, but they're just not able to connect to a great source of capital. There's also regulatory hurdles. Strict regulations can slow down the approval process for new tech and treatments, and so there's innovation that needs to be done in that space. High costs. Developing and implementing innovative solutions often requires significant time, significant financial investment. So one of the things we have to change is we have to start adopting a more long-term view in our innovative timeline and within the life cycle of companies. There's also resistance to change. When a system is present and it's entrenched, it can be there can be a fear to adopt new technologies due to established practices and fear and that fear of disruption. And one of the well, now we can shift into talking about some strategies to overcome barriers. We can streamline governance and regulatory processes. We can develop diverse funding sources. And then for the resistance to change, we can apply agile change management. We can also, when we speak, we can speak with statistics and proof from successful local pilot programs. If a local program gained traction and generated results in one locality, then there's no reason why it can't be scaled to other localities and system-wide.
Thank you so much. And we have one final question. What does the future of healthcare look like with the increase of role of technology in small businesses? Now, I think this is an interesting question. Um, I think that with the increase of technology and the importance of small businesses, I do think that that's going to be able to meet the demand that we have missed in the past due to resources, but also due to the cost of healthcare. I think that the small businesses might be able to mitigate those costs. An imaging, an MRI can cost a patient $3,000. Having to retake those images or having to have additional imaging could cost 500 per image. Small businesses, despite not being able to maybe have the infrastructure needed, might be able to utilize newer tools pushed by AI and machine learning that, as we mentioned, might be able to produce the imaging, might be able to produce the data, the analytics faster, and that would reduce the cost. It not only would it reduce the cost, but it would reduce the wait time that that person would have instead of having to wait on maybe a cycle of 3 reviews by doctors and maybe a 2 week time that could be critical to their health and could be life-saving. Now all of a sudden it's been reduced to maybe a few hours. So I think like with the sharing of data, the availability to access data, the availability to share between networks and you're between a hospital and your provider and the patient, you can have greater synergy. Uh, and I think those are really important. And those are things we take for granted. If you've ever had somebody in your family who has passed away from cancer, one of the critical questions and feedback is why wasn't it diagnosed earlier? What happened, what went wrong in the process, and you're left grieving and you're left with so many questions. And a lot of times it's because of all the red tape in the health process, right? So you have to get the referral, and then the other doctor has to approve the referral, and then you're only scaled to get X type of test, and then you move to the next doctor, and he can only give you X test, and then they're also um, not sure if they can move forward because what if it didn't get approved? And then they have to wait on approval for the health insurance. Well, going smaller might reduce that all that burden and might reduce all that red tape that the larger health providers, the larger infrastructures have. And also, as I mentioned, by using an AI and a machine learning tool, that can be life-saving. And we've all had someone who's passed away from you know a cancer or just another chronic illness. And like I mentioned, we're left wondering, like, where did it go wrong in the process? What could we have done better? And time, I think time, efficiency, you know, diagnosing with like better tools, and having that flexibility and that agility is one of the things that I think will change in the future and will have to be addressed. And hopefully, the cost of health can go down and can be reduced efficiently. And so we do have one additional question. Can an AI and a machine learning tool such as telemedicine improve outcomes during measles outbreaks? Hamza, would you like to address that question?
Yes, Anna, thank you very much. So, yes, definitely AI and ML tools in telemedicine can improve outcomes during measles outbreaks. One of the technologies I worked on in the past, worked on selling to our key partners was an algorithm we actually developed in-house to detect the flow of outbreaks like measles. And early detection and monitoring is one of the ways AI algorithms can analyze data from telemedicine consultations to identify early signs of measles in different localities, which enables quicker diagnoses and isolation of infected communities, helping intervene and prevent the spread of the disease early on. There's also predictive modeling, which Anna talked about. Machine learning models can forecast outbreak patterns by analyzing historical data and current trends. And it allows healthcare providers to allocate resources more effectively and prepare for potential surges in cases. And even in cases where it's an iteration of measles or a novel type of measles, you can use the historical data and perhaps create synthetic data to fill the gaps to help you make better uh, predictions, despite the fact that your data set is new and you're seeing new variables in the equation. There's also remote patient management. If your patient is really sick, you have a strong interest in keeping them isolated where they are. And telemedicine platforms equipped with AI can monitor patients remotely, ensuring they receive timely medical advice and support. Thank you, Anna.
Thank you. Thank you for that, Hamza. I would like to add that also, as with the AI and the machine learning during measles outbreaks, it also helps to track. But I would like to emphasize that there's still laws, there's still regulations that should protect the patient data. Your data during, during any analysis and um or any process where you're considered to be like patient zero, and then like you're monitored from there on, and people are being monitored in terms of the spread, you're still under the current laws, you're still subject to privacy laws. So I also want people to remember that there's still privacy laws. There, you still have to adhere to that in doctors, hospitals. The whole system is set up to protect the patient. So even though I know that sharing your data, sharing your information, has become one of those, subject to fear or being questioned, because all your information could be hacked, and all your information could be out for public viewing. Don't be scared. Don't be scared of using the new technology. Don't be scared of using data analytics, of using AI in your next phase of healthcare. As long as you're being careful and you're implementing all the necessary protections for your business, for your patients, for your clients, you should be fine. So with that, I wanted to close out. Hamza, if you have any closing remarks, and like I mentioned, we will. Uh, we will be having further sessions. We will be doing once a month, and closing out, we will be sending out all the questions that were submitted for everybody to review, and we will be providing our feedback on those questions. Hamza, do you have closing words?
Yes, thank you, Anna, for your time and for giving me the floor. I would say as a closing statement to our audience, please follow us at SSAI. We publish white papers and we regularly interface with industry and we generate ideas and discussions that we think we as industry players can and should be having in order to lift all of us and in order to improve outcomes, not for only for our industry, but for patients and beyond.
Thank you so much. And I do want to address one last question submitted by Jonathan. Will the decline in funding impact our preparedness for pandemics in the future? That is an excellent question. I think that that is one of those questions that needs to be tracked and followed. I do think that it is going to affect our preparedness overall on maybe the federal level, but that's where the states come in. That's where the states now have a greater responsibility to kind of follow that. So I think the focus would be more on the state levels, on private industry, on smaller businesses, to kind of track pandemics, to track outbreaks such as the measles. Um, and I think that that's where we're going to see the shift. The shift being where before we were taking direct guidance from the federal level, moving forward, states like California would probably have a greater impact on how things are being tracked and mobilized as a whole. So I think there's going to be a greater dependency on each state to make determination in terms of how they handle pandemics moving forward. Um, and we can actually, actually a really good question. We can actually um, follow up on our next webinar on that particular area, since one of our previous webinars did actually cover infectious disease and how previous tools and works SSAI has done at NASA has been able to kind of transition over to tracking uh, pandemics and infectious diseases such as things that are polluted in the air and or carried throughout the water systems. So I want to thank everybody for joining our call today. I really appreciate you being interested in our webinars. We will, like I mentioned, we will post for our next one. We will continue to post white papers, and we will send out the questions that were submitted with our feedback. Thank you so much and have a lovely day. Bye-bye.
Thank you, everyone.